I think one other thing we should just mention that's really become such a big trend in the skincare industry is this teenage skincare craze, the preteens and the teens. And, I kind of straddle the fence on it, quite honestly, because I think, rather than try to, police it or stop it, I think using it as a teaching opportunity to teach kids really what is important and maybe what they shouldn't be doing. We could use it as a launching pad to just like we teach little kids how to brush their teeth and floss. If we could teach them how to use sunscreen and what moisturizers are good for kids with acneiform skin or acne prone skin, I think we can use it as a teaching moment. We're all familiar with the kids who get irritated by using anti-aging regimens. I mean, all that needs to be flushed out. But I think that's another good place for the dermatologist to interface with the acne patient in the office, talk a little bit about skincare.
Yeah.
And kind of set the guidelines, put the barriers up on what's acceptable and what's not acceptable so that they don't get what we're calling now the digital dermatosis, where they're getting irritated by who knows what they're putting on their face. We've all seen that too many times. So I think that's a good opportunity for maybe our skin dermfluencers to really go out there and teach the kids who are listening.
Yeah. In the end, and I think every time I'm asked, please educate on skincare, what's the best, product to use, or how would you deal with this issue in the media or whatever, I tend to always kind of, at the end, I always say, and then visit your dermatologist, because it's really difficult for someone that doesn't have the education in the skin to develop the kind of regimen that your skin needs.
Right.
And it changes over time as we've been discussing for the last 30 minutes. So I do think that we just, as dermatologists, need to be prepared for our patients to come in asking these questions on skincare, because it's becoming so much more important to our patients, especially in the longevity aspect of skincare. So, I think our colleagues we all just need to be prepared for that and make sure that we're meeting our patients' needs in that respect. I know it's super easy just to focus on the acne and the eczema and the psoriasis, but when they do ask about, skincare regimen, it means just as much to them as curing their eczema.
Yeah. And maybe more, depending on who it is. I always love to quote Ruth Tedaldi, you got to be the genius bar of skincare.
Yeah.
And that it's really good, because that's really who we should be. And it's such an important part of what our patients want to get from us.
Yeah.
And if they don't get it from us, they'll get it from somebody else.
Yeah, the digital dermatosis.
the digital diagnosis causing digital dermatosis.
Yeah. I always learn something with you. Oh my gosh.
Because I stalk social media, because I just am totally fascinated by it.
You stalk it. I avoid it. It's a perfect combination.